If you have neck pain or get frequent headaches, then this might be the video for you. My name is Mike Keenitz, and I'm interviewing Rick Olderman, who is a physical therapist and the author of the Fixing You book series. Today, we're going to be talking about common causes of neck pains and how you can prevent headaches. If you want to listen to the full interview, you can check for the link down below in the description box. All right, next topic, we're going to talk about neck pain. So what are some common neck pain exercises you prescribe for your patients?
Okay, this is a really funny one because I was looking. So I wrote these Fixing You books, and one of them's on neck pain and headaches. And I looked at this one woman's review. She was really happy. It solved all of her neck pain and headaches. And her review said, "This works because it doesn't have any neck pain exercises at all. None at all." All in caps and exclamation points. And that's exactly right. A lot of people have seen a lot of practitioners for their neck pain and headaches, and their practitioners have consistently been looking at their neck and head, but that is not where the problem is. And if you have chronic neck pain and headaches, you can confirm this. Really, what the problem is our shoulder blades. And so there are significant muscular attachments from the shoulder blade into the neck and the head. But because of our component training as medical professionals, we think that neck pain must have something to do with the neck, or the headaches must have something to do with the neck or head. Hardly anyone has ever looked at the shoulder girdle system as the cause of neck pain and headaches. And I just want to kind of bring this around for you. So there's only if you look at the skeleton, there's a whole bunch of long bones like this, but there's only two places where wide bones happen, like at the pelvis. We all know that the pelvis is the center of function for our lower body and back system. Similarly, the shoulder blade is the only other place in the body that has a broad bone. It is the foundation of all of our upper extremity system network, including the neck and head. So this is where the source of almost all problems are. So the most common problem that's occurring with shoulder blades that affects the neck and chronic headaches, and I'm talking migraines too, is that the shoulders are resting too low. This is happening for a variety of reasons I won't go into, but just trust me that this is the most common dysfunction that's happening here. And so there are muscles connecting from the shoulder blade into the neck and the head. And so when the shoulder blades are resting too low, these muscles that go up have to work harder. And this is where neck pain and chronic headaches come from. All right. So here's the easiest way to solve this. And you don't even have to do an exercise to solve this. When you go to the most common reason, one of the reasons that this is happening is because of how we're sitting at work. Most people are sitting and working on a computer during the day. Many people don't have arms on their chairs. And those people who do have arms on the chairs, the arms are resting way out here away from their body and are useless because the elbow has to come way out in order for them to rest on that. So what you need to do is bring the arm of the chair into the body so that the elbow is resting about an inch higher than normal, which is going to push the whole shoulder blade up, which then puts all of these connections into your neck from the shoulder blade on slack. And you won't believe how much better your neck pain and headaches will feel with just a day or two of doing this. Even just a half hour of doing this, you'll know that it's the right thing. So the thing is that a lot of people's chairs the arms can't come in close enough to the body to make this happen. So my quick and dirty solution for this is to bring a couple pillows from home, just regular sleeping pillows, fold them in half and put them between your waist and the arm of your chair. Usually those will rest somewhere higher than the arm of your chair does naturally. And you'll have a broader surface and cushier surface to rest your elbow on. And you want your elbow, again, close to your body, and you want your elbow at the midpoint of your rib cage. So when your elbow is here, you can see where this hand is on the skeleton. That's exactly where your keyboard should be. So if I'm setting up my computer so that my arm is resting at the seam of my shirt here, and my shoulder's resting a half inch higher, wherever my hand is here is where my keyboard should be. Most people will find that their keyboards are further forward, which means that the further forward that is, the more I have to activate my neck and shoulder muscles to hold my shoulder up. You can test this yourself just by going to work and trying this out. And you'll notice that your neck doesn't feel nearly as supported when your keyboard is away from you as it is when it's near you. So just making this one change to your workstation will probably solve almost all of your neck pain and headaches in terms of the pain occurring. There are, of course, things that we can do to fix the shoulder girdle system, but to get you out of pain as quickly as possible, this would be the number one recommendation I'd make. Now, a lot of people use mice when they're working, especially people who work on spreadsheets and things like that. And usually that mouse is way far away from them. So if you're a big mouse user, what I also have people do is, hey, let's bring that mouse in close to the body where my arm is resting at the seam of my shirt and my hand is near me. And then let's scoot that keyboard over just a little bit to the left if you're right-handed. And so, and then put my mouse closer to the center of my body since I'm using it a lot. I solved one guy's 20 years of neck pain just by getting him to change where his mouse position was for all of these systems reasons that we're talking about. So that would be my biggest thing. I can give you an exercise that will solve it too, but this is the biggest change that you can make that will take it away almost immediately.
Do you have any exercises besides that big recommendation?
Oh, sure. Yeah. So if you think about the shoulder blades resting too low, what we need to do in part is stretch the muscles that are pulling the shoulder blades too low. All right. So the easiest exercise to do that, if any of you are familiar with child's pose, you get on your hands and knees and you sit back on your heels and your arms are up overhead like this on the floor. You will feel a big stretch in the armpit area when you're doing that child's pose stretch. And that is you stretching the shoulder blade depressors. And to take it a step further, when you're in that position, you can walk the hands over to one side and the other to get an even bigger stretch in those scapular depressors. So that is one really simple exercise to stretch out the muscles that are pulling the shoulder blades down.
If someone can't get to the floor, can they go like above head and then do it?
Yeah. So what I also have them do, if you can't get to the floor, you can do this just by holding on to a doorknob.
Oh.
Open a door, hold each doorknob, and just lean back and get down there as deep as you can, and you'll feel that big stretch happening through that whole area.
Oh, yeah.
Really easy. A railing, a doorknob, it's really easy to do anywhere. You can do it sitting at your desk too. If you're sitting at your desk, just drop your head and chest down to the desk, slide your arms forward, and you'll feel the stretch in your shoulders right there.
Sure.
So really easy.
Or countertop too, probably.
Countertop, any number of ways to do this. Yeah.
All right. Any other tips or tricks for neck pain?
Yeah. So, that should probably, at least if you're unsure whether this systems approach will help you, that would be a great way to test it. And this is how immediate it is. What I'll have people do, I have this little test I developed called the armpit test. And basically what I do is to test whether the neck pain or headaches is coming from the shoulder girdle system. I stand behind the patient. So here's the patient. I stand behind them and I have them first move their head around up and down and so forth to test their neck pain, range of motion, all that kind of stuff. Then I put my hands underneath their armpits like this and lift the shoulder blades about an inch higher. Now, the patient has to relax their shoulder blades into my hands. They have to let me hold that. And so what I'll do is I'll jiggle my hands around just to get them to really relax that. After about 30 seconds of me holding those shoulder blades up there, I ask the person, now go ahead and move your head around again and see how that feels. Almost every single time, people are just like, I can't believe how good this feels. Can you follow me around like this for the rest of the day? And the reason is, once again, I'm unloading the shoulder girdle connections to the neck and the head by lifting up the shoulder blades. Now, there's a small percentage of people who will say, I don't feel any difference. These are the people that tend to have a harder time relaxing their shoulders to allow me to hold it. So what I then do is I lower the system back down. And once I lower that back down, then they get it. They're just like, oh my God, I feel that on my neck right up immediately. So sometimes your response will be delayed and you'll have to have that person lower that back down to really get the true result. But anyway, that would be my recommendation. If you're not sure whether what information I have is helpful for you, there's the definitive test. All right. But putting those pillows and changing your ergonomic setup at work, if you do that for a few days and your neck pain starts to go away and your headaches, it's confirmation that your shoulder girdle system is not working correctly. And that's what my program helps you solve.
So you offer this in book form, like you said, but then you also have a program on your website for this as well?
Again, I've created a downloadable home program that's much more specific. And again, it also has the taping techniques I have to solve these problems so quickly. So I use tape as a bridge to function. So when I tape like a foot or a shoulder blade or some other area of the body, it's so that we can see very rapidly what, if everything was working perfectly, what that would feel like. And invariably, people never want to take off the tape because it almost completely takes their pain away. So then all the other things are to get the body to do this itself. And so as the body, as we correct the tight or weak muscles or whatever, or the movement habits or whatever, we start weaning people from the tape. So then they don't need it anymore. But the tape is a beautiful bridge to show people just what their bodies will feel like if everything was working perfectly. And my books don't have those taping techniques, but the downloadable home programs do. And I even, especially in the neck pain and headaches one, I have a maneuver that I do with the shoulder blade to loosen it up from the trunk, so that it will restore normal movement of the shoulder blade. And that's in the extra help session. All of my programs have an extra help section section that has the taping techniques, but also it has exercises that you can take to your practitioner, ask them to do this for you to help you solve your pain. So it goes, I go into basically everything, but it is very simple.
All right. So where could people find more information about you, your programs, and you want to talk about your new book as well?
Oh, sure. Yeah. So if you go to rickolderman.com, there's a little tab there that says products. You'll see all of my books, but you'll see all of my home programs. And you'll see I've created an online practitioner training course to teach practitioners this way of solving pain. For physical therapists, in most states, you get 30 CEU units, which is huge when you complete the course. But frankly, I believe that this information should be known by personal trainers, Pilates, yoga instructors, because those are the people that see people with pain first before they ever come to someone like me. It's way down the road when they come to me. So I'd rather them nip this in the bud by understanding how it is that we really do move. So if you do buy any of my products, the home programs or the online course, if you type in Bob and Brad, I think it is your code. So if you type in Bob and Brad, all one word, you get 20% off of that product.
Yeah, I can link it down below. And for practitioners, Bob and Brad are doing your CEUs, so they're very interested in this and want to preach it more.
Yeah, it works. And this is the resounding, the way this online training program works is the same system I've used to train my therapists over these past 10 years. And I've been honing it throughout those years to make it more specific and easier and faster to implement with your own patients. Sure. It's really effective.
So what's your new book called that's coming out?
Oh, yeah. So I've got a new book coming out called Solving the Pain Puzzle. And those are cases from my 25 years of practice as a physical therapist. And basically, I wrote that because I wrote my Fixing You series of books about 10 or 12 years ago. And I've had lots of Zoom sessions with people and talked to lots of people who have read the books. And they're just like, I love these books. And especially, I have these little client connection paragraphs in there where I talk about how this principle solved this person's pain. So I decided to turn it on its head and make this solving the pain puzzle about the patients instead of the mechanics of the pain. There's a little bit about the anatomy and physiology in there, but I use their stories. Their stories are front and center, and I use those to help people understand how the systems approach can help them. And so I have cases from the foot to the head, solving pain, and so to give you an idea of how different this approach is and how powerful it is, as opposed to the standard types of work that you've been used to receiving.
Are there any other things you would like to mention?
Yeah, if you want to pre-order that book, that's also on rickolderman.com. And actually, I've got a few chapters from the book. If you want to read them or listen to them, I've made an audio version of them. You can just go to that website and listen or read them and pre-order my book there. It should be coming out sometime in 2023.
And our listeners, if you like Rick, we're going to do another podcast kind of talking about the book more soon.
Sounds good to me.
All right. Well, thank you for joining us.
Thank you, Mike. I really appreciate it.